Hi everyone, welcome to my channel CAPSA. Today we will understand about Myasthenia Gravis. So Myasthenia Gravis, these are two words. First word, Myasthenia, obtained from a Greek word. It's a Greek word, means muscles without strength. Muscles without strength. And gravis, obtained from a Latin word meaning severe. So my means muscles, A means without, thenia means strength, muscles without strength. Now looking at the definition, it is a chronic, complex autoimmune disorder in which immune system destroys the neuromuscular connections. So which kind of immune system? These are actually antibodies. Which kind of antibodies? IgG antibody, which attacks the neuromuscular connections or neuromuscular junctions. Which area of neuromuscular junctions mainly affected? The nicotinic receptors or ACH receptors are mainly affected. So we can say that it is a kind of post-synaptic neuromuscular junctional disorder because these nicotinic receptors are present in the synaptic membrane of the neuromuscular junction. So we can say like this: the prevalence rate of this disease ranges from 150 to 200 cases per million worldwide, and it is observed that women are more affected than men at their very young age, sometimes in their 20s and 30s. Now we will see what are the types. So according to onset, first one is congenital, second one is acquired. And according to the clinical manifestations, first one is ocular, second one is generalized. Okay, so congenital means actually inherited. And in this case, syndromes are usually appeared at birth or early childhood. And it is a lifelong condition, generally no cure, only preventive treatments are available. So which kind of inheritation occur? It's a kind of autosomal recessive disorder. Okay, in which the affected child obtain two copies of abnormal gene, one from each parent. Acquired means not hereditary, it means it develops during the lifetime. And ocular means based on the ocular observations, and generalized mean with ocular all other things are considered. It is observed that 60 to 70% positive patients have Thymus, Hyperplasia and Thymoma. 10 to 12% have Thymoma. So Thymus hyperplasia means larger in size. So when the thymus gets larger in size, known as Thymus hyperplasia. And if the thymus have a tumor in the epithelial tissue part, it is known as thymoma. So thymoma is a malignant tumor of the epithelial tissues of the thymus gland. Okay. Now coming to the next, what are the sign and symptoms? So the first symptoms is fluctuating weakness. It means when you do some workout, you will see sometimes weakness, then recovering, then weakness, this kind of fluctuating weakness, and it is more prominent in the afternoon. Okay. Second one is ptosis. It means drooping upper eyelid. Third one is diplopia, meaning double vision. Fourth one is blurred vision. Fifth one is muscle fatigue, muscle weakness, but without any pain. Sixth one is dysphagia. Dysphagia means difficulty in swelling. Whenever the patient will try to eat something or swallow something due to weakness of the mastication or jaw muscles, weakness in the jaw muscles, the patient will fail to swallow or chew. Okay. Cachexia stands for the loss of body weight and muscle mass, and Dysarthria represents the slurred, very much slow nasal speech. Okay, so these are the sign and symptoms. Coming to the next, what are the diagnoses? How will you diagnose the patient? So first we can say that based on some common observations. First one is ocular ptosis, bilateral INO. INO stands for internuclear ophthalmoplasia. Okay, internuclear ophthalmoplasia. Third one is myasthenic sneer. It's a kind of unique smile of myasthenic patient. And the second one is based on the laboratory findings like Edrophonium test, also known as Tensilon test, and IVIG test, serological testings. Others are electrophysiological studies, CT scan of the chest to rule out if there is presence of thymoma or thymus hyperplasia, this kind of. And these two tests are also known as bedside test. In Edrophonium test, what it is done? Edrophonium is injected for looking the improvement of the eye muscles. IVIG test, in IVIG test, IVIG actually placing over the ptosis eyelid for 2 minutes, because it is believed that cold temperature can affect the enzymatic action. Which kind of enzymatic action? Acetylcholinesterase kind of enzymatic action. And serological testing is nothing, just the acetylcholine and antibody testing. Okay. Now, this is the patient of Myasthenia Gravis patient with ptosis, or you can see the drooping eyelid. This is the drooping eyelid. Okay. Look, this is the normal eyelid and this is the drooping eyelid. And second one is bilateral INO. When the patient tries to look right or left, it fails to do, because this portion should come this here and this portion should come here. So the patient fails to do so. This is bilateral INO or internuclear ophthalmoplasia. Okay. Now this is myasthenic sneer or unique smile of Myasthenia Gravis patient. So when the patient tries to smile, you can see the mid lip arises, but the mouth, corner part of the mouth does not moves forward or fails to move. This is the unique smile of Myasthenia Gravis patient. Okay. Now, what are the treatment? So, first treatment should be symptomatic based on the symptoms by using acetylcholinesterase inhibitors. Which kind of acetylcholinesterase inhibitors? You can consider pyridostigmine, neostigmine, this kind of. Okay. Second one is immunosuppressive treatment by using immunosuppressive agents. Which kind of immunosuppressive agents? Cyclosporine, azathioprine, cyclophosphamide, etc. Third one is surgery. If there is malignant tumor, you should go, it means if there is presence of thymoma, then you should go for surgery, thymectomy. Okay, it's a surgery of thymus gland. Fourth one is myasthenia crisis, means when there is exacerbation of the myasthenia gravis, then you should go for IVIG, it means IV immunoglobulin therapy, or Plasmapheresis, which is simple just plasma exchange or plasma exchange. Okay, so this is the end of my lecture. I hope you understand Myasthenia Gravis. If you like the video, please do like, comment, share and subscribe. Thank you for your attention.